morning, Al.
Good morning,
Good morning.
Hi, Joe.
Mr. Guevara.
Morning.
Ayan na si Mike.
Dr. Guevara.
Hi.
Without further ado, I would like to call my dear friend, who has since left us for sunny Florida. She now lives in the Naples area, Dr. Claveria.
Thank you, Al. And greetings from the sunny state. Good morning, everyone. I hope you are well and completely vaccinated. I am here today to share with you my experience as a COVID-19 patient. But first, allow me to acknowledge and give thanks to my family for their love and support throughout my ordeal, to my medical team at Northwestern Lake Forest Hospital for excellent care, and to friends and teammates, especially, of course, Dr. Nita, my BFF, who tirelessly check on me every day and drop off delicious Filipino food at my doorstep while I was recuperating. Thank you very much. I got COVID-19 in March, about a year ago, when the pandemic was just unfolding and when we knew very little about this virus. When CDC recommendations kept on changing, when COVID testing was not readily available, when there was a shortage of PPE, and there were just a handful of available treatments, mostly based on anecdotal evidence. So I was post-call on Friday morning on March 27, headed out from the hospital, feeling very exhausted. I thought it was from busy work and lack of sleep the previous night. So I took naps and cleared my office schedule. Still, the extreme fatigue lingered for next few days. Then I lost my appetite, started to have chills without fever, and had occasional cough. I knew deep inside I needed to be tested for COVID. At the time, testing was not readily available. One has to meet a criteria or go to ED and declare yourself sick. Thankfully, I was accommodated like Forest Hospital on Sunday night, but it would take 2 to 3 days for the results to come out. Meantime, my symptoms worsened. Aside from loss of appetite, I also lost my sense of smell. The aroma of food, even my favorite arroz caldo, was so offensive. It bothered me so much, even with my mask on. My right face along my maxillary sinus was so painful, and my right eyeball felt as if it's ready to pop out. I was tempted to go to ED, but a couple of Tylenol relieved the pains. My daughter even reminded me I really might have COVID-19, so I started to monitor myself. I did prone positions and checked my pulse oximeter readings. On Tuesday night, March 31, I got an early phone call, a confirmation of what I already suspected. SARS-CoV-2 PCR was detected. I was infected. By this time, I had diarrhea and vomiting. I could hardly keep down anything. I felt very weak and wobbly. My daughter panicked when she saw me at FaceTime and she screamed at me to go to the ER immediately. So I did. It took 2 people to walk me up to the nearest room. And when the door shut, I was surrounded by these Martian-like creatures hovering over me, doing different things in a rapid sequence. So in seconds, I was down, connected to the monitor, had IV hooked, blood drawn, EKG and chest X-ray were taken. A few more minutes, I was told I have a very serious electrolyte imbalance with severe hyponatremia and hypokalemia. And of course, my EKG was abnormal. I was so much relieved when the pulmonologist critical care team informed me that I did not have pneumonia and my COVID-19 markers were not so bad, and that they will be on standby if I would ever need them. So this was the best thing I heard that day. I was confined in isolation at the telemetry, and on the second day, when my EKG returned to normal, I was started on 5-day course of dihydrochloroquine and azithromycin. These two medications were popularly used at the time, and although not scientifically proven, it showed some anecdotal evidence that it helped some patients. I was praying that I would not develop pneumonia or other complication. I knew I was not out of the woods yet. Being alone in the hospital without my loved ones at bedside and uncertain of what could happen was a horrible experience. I was so anxious and scared. I could not eat. It's hard to find sleep. My eyes were red. I was not sure if it is from lack of sleep or from COVID. My sources of calm were the phone calls and FaceTime from family and friends, and the wonderful and compassionate care of my medical team. When I was nervous, I sought refuge from my faith and prayers, and God was my constant companion. This made me feel I was not alone. At home, recovery was not easy. It took longer to regain my strength, and I quarantined for 2 weeks. I remained anxious, especially when my husband started to have symptoms that I had, such as diarrhea, loss of appetite, and smell. But I was thankful he got better in a couple of days. My care team checked on me daily for a week and monitored my recovery, which gave me much comfort and reassurance. I returned to work after 6 weeks, eventually developed antibodies, and was able to donate plasma. It has been a year since my COVID diagnosis, and looking back, I consider myself lucky to have no serious consequences. We have heard from post-COVID patients of these lingering symptoms, collectively termed as post-acute COVID syndrome, some of which are debilitating and needing medical interventions. We learned more about this from this morning's talk of Dr. Sala about long COVID. But in my case, though, I considered my long-term sequela as minor and manageable. My sense of smell did not come back completely. I could hardly differentiate scents unless I see what it is or unless I sniff it longer. It seems the smell are all the same, but surprisingly, it is not offensive. So I guess this must be a blessing, not a curse. So that was my experience. Have a pleasant day, everyone, and thanks for listening.
Thanks for waking up early, Philip, to join us. Dr. Felipe Enriquez, MD, FCCP. Philip? Yes.
Well, first of all, thank you for your kind introduction. Al has been a very good friend of mine from residency and up to now. Just as a background, I am already in the 70s, and so that's a very risk factor of my of COVID, getting severe COVID disease. However, I am physically active. I'm up to now, and prior to my illness, I was walking like 3 to 5 miles a day in our neighborhood. And my other morbid conditions are coronary artery disease, for which I had the stent also, just like Dr. Renato, and also being treated for hypertension, which is under control. And with my age, I am a candidate of having severe disease. However, during the time of my absence here in my house, I was staying in hotels. I have been, there is no restaurant open at that time, so I have to do groceries at Walmart twice. And I've been exposed also at the airport and airlines. So those are the possibilities where I get my COVID. I double check on the hospital that I work with, and none of the hospitalized patients that I took care of has COVID has been COVID positive. So there was no traceable known contact for me why I have been why I get COVID, other than those places that I traveled, like as I mentioned, while I was traveling in Illinois and Nevada. My symptoms happens like 3 days after I arrived from my work. I'm already here in San Diego. My symptoms in, consisted of just severe headaches. In fact, this headache is just localized in the temporal parietal area. That I thought that I may be suffering from temporal arteritis, and so I called my internist, and we did the blood test for CRP and SED rate and CBC, and all of them turns out to be normal. The symptoms continued. I did not lose any sense of smell or any sense of taste. It was well preserved in my case. The other problems that I encountered are severe weakness, muscle aches, and just feeling run down that I could hardly go up and down the stairs on my house. So I stayed in my room, and my wife has to bring my lunch, and then we check on our pulse oximetry, and I find out that it was down, just hovering between 90 to 93%. And then the following day, it went down to 80 every time. I mean, like 85, 88% when I do an activity. So that's about 7 days after my arrival here. We called an ambulance, and I was sent directly to local hospitals in San Diego, in intensive care unit for COVID patients. And the result come back to be positive for COVID in the same day that the test was tested. The other problems that we encountered is that the chest X-ray is showing bilateral infiltrates, and this was shown to me at the same time that day. So medication-wise, I was started, and of course, it was early on because that was at the end of March or early April. So it was still pretty new, and so there is no definite consistency as to the recommendations of severe disease. Anyway, the hydrochloroquine and azithromycin has been started with vitamin D, vitamin C, and magnesium, and of course dexamethasone. And I, being also post-stent, I was already taking aspirin and Plavix. That was discontinued after I was intubated, and I was intubated just on the second day after I was hospitalized because of the worsening hypoxemia and chest X-ray showing further progression of lung infiltrates. So basically, I was on ventilator support and complete sedation for 4 days. And the 5th day, apparently my condition has improved significantly that they were able to wean me off respiratory support. And Oh, by the way, the sputum cultures also showed that I have bacterial pneumonia consisting of Staphylococcus aureus and Klebsiella, and I was put also on meropenem and Rocephin, in addition to, of course, steroids and heparin. Now, after the 5th day, I was extubated and I was put on high flow oxygen, and my feeling was so weak. I was almost like feeling like a noodle and very shaky. The subsequent hospitalization consisting of just mainly continuation of steroids and antibiotics and intensive rehabilitation to make me be able to at least walk and without support. So that is my the situation and my condition of my ailments, and I was so lucky that I was able to survive at this ordeal with and other things that my wife, I did not infect my wife by physical distancing and carefully keeping my stuff out of the house. And use of hand washing and alcohol and and just be careful not to expose anybody by self-quarantine. So 2 weeks I was in the hospital, and after another 2 weeks in my solitary confinement in one room, quarantine in my house. My wife has to bring my my food into my room without getting her exposed to me, and that's how she is able to prevent getting infection. Complication-wise, the only thing that COVID had done to me, of course, is the secondary pneumonia, which has been treated, secondary bacterial pneumonia, which was treated with antibiotics. And the most recent chest x-ray was done a month after my COVID, and it is completely normal. There was no evidence of fibrosis or any infiltrates in my chest x-ray anymore. Okay. As far as I think the thrombosis, which is common also among patients with COVID, luckily I did not get that with my anticoagulation therapy during my course of treatment in the hospital. Now, as far as the hydrochloroquine early on, as far as treatment, there was really no treatment at that time that is acceptable yet, other than questionable possibility that hydrochloroquine and azithromycin may be helping, but as of this time, we really don't know whether it really helps or not. But so far, I didn't get any complications of hydrochloroquine from cardiac standpoint, which is good. I think the advantage in my situation, even if I got the severe disease, is that I have been very physically active prior to this illness. And being non-smoker, I was able to recover without any problem from my bacterial pneumonia as a resulting of COVID. And I believe that the lung disease that I got was mainly from bacterial pneumonia rather than acute respiratory distress syndrome associated with COVID. So that is all I have for you today, and thank you for your listening. Al, I'm done.
He will talk to us today about his experience with the COVID disease. Rene?
Okay. Hello, everybody. Hey, Al, thanks for that introduction. And thanks for having me to share with you my experience during my COVID ordeal. Okay. And good afternoon to everybody. And I'd like to thank all of you for your time, for listening. Al, thank you for having me here. Well, anyway, I got the COVID infection in November 9. So that when the COVID infection came, like in February, March, like that, I'm trying to avoid and doing everything I can. And 3 or 4 times in our office, we have to close it down because we had patients who had suspected, COVID, and then go back and practice again. And I go to nursing homes, several nursing homes, and 2 of them, I'm the medical director. We follow the Department of Health of Highest guideline as to how we, manage things to a point that up to November, I was able to avoid getting an infection at all. It all started that when my daughter, and this is one thing that I would like to share with everybody too, my daughter who was pregnant, 36 weeks pregnant, got infected with COVID. She owns a salon, and 4 of her hairstylists got infected. She has to close down her salon. She got very sick, trying to treat her, and her condition got worse. So I was the one who took her to the emergency room. At that time, I was already suspecting that I am carrying the virus. So I tried doing everything I can with the mask. Of course, we're in the same car. And then when she was in the hospital, all the testing were positive. However, her COVID testing was positive. But then she was sent home. I took her home, but she was sick. I was trying to bring their food, leave it on the porch. And then before I know it, she got worse with her, breathing. So I told her, I have to have you admitted to the hospital, with this shortness of breath that you have. I can't let you or the baby be compromised because of your oxygen. Anyway, she was admitted. And when she was admitted, I actually even begged the infectious disease guy, to start with the remdesivir. However, he said, I can't give it because she's got transaminitis. I said, well, COVID will do that. Okay, why did you just give it? If that's your daughter, would you rather have the medication given? She got worse, she might get intubated, and she might not make it. But anyway, we give it to her anyway. And the other thing that happened during the time, the first baby she had was cesarean section. When she came in, the platelet was so low, and we're also worried, that that might, compromise her with COVID, and then she's going to have cesarean section, and she might bleed. So I talked to the OBGYN, and I asked him to transfer the patient to Ohio State University because they have a ward for COVID-19 for pregnant women. She stayed there for 3 days. All her enzyme went back to normal. And then during that time period, I think it was about 7 days, 9 days after I was exposed to her. The first time I did it, it was negative. Okay, 9 days later, that's when my test came out positive, but I was asymptomatic. That Friday night, I had chills, and chills and fever. And when I woke up in the morning, my shirt was soaked. I could wring my shirt, okay, and then put it in the dryer. And then the first thing I noticed was my muscle ache and my shortness of breath. I was so short of breath that, talking like this, I have to catch my breath. And then when I walk, and then I had like 60 steps, I was very, very short of breath. I have a lot of risk factors. I have hypertension. I have high cholesterol. Okay, I have coronary disease. I had stent put in. So I was just wondering, should I go to the hospital? I checked my saturation. It was actually like 91, 92. Okay, I was wondering that if I should just stay there. And then I started actually treating myself and my daughter, even my wife, okay, with a cocktail I give my patients, with the antibiotics, Supermax, steroids, zinc, vitamin C, vitamin D, everything. All right. So anyway, I was just waiting for that time that my breathing would become very, very bad, and I didn't have any choice but to go to the hospital. But fortunately, I also used the inhaler that had the budesonide. Okay, so I gave my wife that. I had mine, and then I had my wife tested for the COVID also, and she turned out to be positive. She said, "Okay, honey," I said, "I think we can remove our mask now." So anyway, during the time I stayed at home, and my feeling of the ache that I had in my back, okay, the myalgia I had was like, you played basketball for 2 games, you never had played basketball before, and then all of a sudden you have this aches, and then you feel so tired. So I was fatigued. I lost my taste. I had headache. I have stuffy nose. And then during the time, and I lost like 20 pounds. But anyway, after 10 days, and I thought I can go back to work. I went to work. I was still very short of breath. And I told them I'm going to have to stay home, and then stayed another 2 weeks at home. So I was off for 3 weeks. And then when I went back to work, I still get the shortness of breath, especially when I exert. And then slowly my symptoms got better. Okay, and then before I know it, my nurse practitioner got the COVID, and 2 of my receptionists. So we have to close the office again. And then since that time, my nurse practitioner was hospitalized, and she was hospitalized for 10 days and didn't go home until about 3 weeks later. So I would, consider myself lucky that I didn't have to be admitted to the hospital. And with my, medical condition and the risk factors that I have, I could have gone in the office. As a matter of fact, my primary care physician 3 weeks ago died of COVID. So anyway, right now I'm just still practicing the social distancing, wearing the mask, washing my hands. And I can only pray that, I'm thankful to God that, I'm still here. And I hope that you guys will, take care of yourselves too, be safe, and just do whatever you have to do, trying to follow the guidelines, the protocol that we have here. And I think that's it.
Thank you very
Okay.
Thank you very much, Rene.
Yeah, I just have a question about the efficacy of the vaccine and the practice that we are asked to do, I cannot understand how, after completing the required 2 doses of either the Pfizer, Moderna, or whatever, you would still be considered a danger to somebody if you don't wear a mask. Now, is there a possibility, like we know viruses do not stay very long unless they enter a cell and replicate? So how do you explain that I should still feel that I could be a danger to anybody after I have received the vaccine that is 95% effective?
I don't think it's really referring to how you can transmit the virus to someone. I think it's just a general guidelines so that everyone would follow it with no exceptions. And I think over time that is going to change. I don't think you would want anyone who is, a patient of yours or someone you're talking to ask why you're not wearing a mask. And again, if you just got the vaccine a week ago and you started not wearing a mask, you could possibly still be infectious if you had the virus.
Yeah, well, I'm talking about after the known time where you can presume, right, that you're 95% immune. It's
we have to, yeah.
I don't know. Anyway,
to be concerned
it's hard
also,
to follow something that is against reason.
I understand,
especially when you're dealing with family and family gatherings, or when you're outside.
Yeah, you might still get infected, but it might not be a bad. You might not end up hospitalized or anything like that. So that's the reason I think it's best to follow the guidelines.
In the chat, is it safe to give the vaccine to a person who has plaque psoriasis?
Yes.